a single pill that can burn fat, stabilize blood sugar, and preserve precious muscle mass without the usual side effects of nausea or the loss of appetite. If that sounds too good to be true, prepare to have your mind changed. Researchers from Karolinska Institutet and Stockholm University believe they've stumbled upon a potential breakthrough in the fight against type 2 diabetes and obesity. Today, we're going to dive deep into this discovery and find out why their new oral drug candidate might just overturn everything we thought we knew about metabolic health. So, what's really going on here? And how does it tie into the daily struggles faced by people with type 2 diabetes or those coping with obesity? Today, we'll investigate the core challenges these individuals encounter, discuss how current treatments sometimes fail to strike the right balance between effectiveness and tolerability, and reveal the astonishing new data that indicates a future full of hope. In this episode, we're exploring several burning questions. How does this new compound work within skeletal muscle to deliver its impressive outcomes? Is it truly possible to lower blood sugar and shed fat without a persistent feeling of nausea or a troubling decrease in appetite? Has someone finally found a remedy for the unwanted muscle loss often triggered by existing therapies? And most importantly, what is the next step toward turning this lab-based breakthrough into an everyday solution accessible to everyone who needs it? But first, let's step back and consider the magnitude of the problem. Obesity rates have been climbing globally for years. In many nations, a significant percentage of the adult population is grappling with weight issues. This steep rise has fueled a parallel surge in health complications, most notably type 2 diabetes, which stands as one of the leading causes of reduced quality of life worldwide. Now, research and pharmaceutical efforts have not exactly been stagnant, far from it. Over the past few decades, scientists have studied countless molecules, tested new pathways, and tried to decode the complex networks that regulate our metabolism. Some drugs have emerged powerful enough to help manage high blood sugar, but at a price, side effects that can be disruptive and discouraging. Enter our new oral drug candidate, a complete departure from the wave of well-known GLP-1 based medications. Those established drugs, including the likes of Ozempic, have certainly helped drive down blood glucose levels for many patients. However, the way GLP-1 medicines work, regulating appetite signals between the gut and the brain, can also mean there's a loss of appetite, gastrointestinal distress, and even the risk of losing lean muscle mass. Worse yet, the reluctance many people feel about self-injecting these medications can also be a huge barrier. The new approach from Karolinska Institutet and Stockholm University flips that model on its head by activating metabolism in the skeletal muscle, sparing patients from the nauseating and appetite-diminishing aspects so common with older therapies. The scientists behind this concept see enormous potential in rewriting the rulebook for how we treat metabolic conditions. If that concept intrigues you, keep listening. Today, we explore how this new compound, derived from a special type of beta-2 agonist, brings about a cascade of beneficial metabolic effects. By focusing the action on pathways in the body that are specifically triggered in the muscles, these scientists have managed to avoid overstimulation of the heart, a notorious problem that earlier generations of beta-2 agonists faced. Instead, they have isolated and refined the molecular features that drive muscular energy usage. Here's the crux. Muscle cells burn glucose for energy. Stimulating that process can help reduce overall blood sugar levels, while also knocking down accumulated fat in the system, because active muscles demand more energy, pulling both glucose and fatty acids from the bloodstream. Now, maybe you're thinking, this all sounds so wonderful, but where is the proof? Indeed, animal studies formed the earliest stepping stones. Lab mice and rats placed on this medication displayed significantly improved glycemic control. They also showed signs of increased lipolysis, or fat breakdown, without exhibiting the typical signs of reduced appetite or the muscle loss watchers of the field have come to dread. Even more incredibly, the animals continued to eat and move around normally. When you've got a medication that transforms metabolism, yet doesn't bring about the usual gastrointestinal nightmares, you've got a game-changing candidate. Of course, results in animals don't always translate perfectly to humans, so the researchers then initiated a phase 1 clinical trial. In that trial, numbering less than 100 participants, roughly split between healthy individuals and people with type 2 diabetes, the new drug candidate demonstrated compelling safety data. Volunteers tolerated the compound very well, with minimal side effects. No one reported that dreadful perpetual queasiness or appetite suppression so common with existing treatments. And while the trial was small, with only a brief treatment period, the data confirmed that the medication showed promise in terms of blood sugar control. Now, obviously, a phase 1 study can't prove everything, but it did establish a solid foundation for the next steps. It's one thing to talk about injecting a new experimental drug in a lab or giving it to rodents, but seeing real human subjects come through with positive signals is far more significant. Before we reveal more about the next stages and the multi-institution effort behind this new compound, let's pause for a moment. If you're finding this story as thrilling as I do, especially if you or someone in your life has faced the daily challenge of managing type 2 diabetes or obesity, go ahead and show your support. Give a quick thumbs up, share your thoughts or questions in the comments, and consider following this channel so you never miss our deep dives into the latest medical breakthroughs. All right, with that call to action out of the way, let's move forward. It turns out that this potential solution isn't just a single lab project. Collaboration spanned multiple centers in Sweden: Karolinska Institutet, Stockholm University, Uppsala University, extended into Denmark's University of Copenhagen, and went all the way to Australia's Monash University and University of Queensland. This wide-ranging network of expertise came together to perfect the molecule's design, carry out the cell-based and animal-based experiments, and interpret the clinical data. What we're witnessing is a prime example of how large-scale international scientific teamwork can expedite discoveries with massive implications for public health. A particular point of emphasis is that the new compound is not meant to compete directly with the existing GLP-1 medications in an attempt to drive them out of the market. Rather, the scientists describe these therapies as complementary. Think of it. If a patient benefits from current appetite-managing solutions, but also wants to ensure robust muscle metabolism, a drug that works via the skeletal muscle might be the perfect partner, providing synergy across pathways. Patients who do not respond well to or cannot tolerate GLP-1 medications now have another promising alternative. And from a medical standpoint, having multiple tools in the kit is always better than relying on a single solution. There's a certain pleasing irony to the fact that amid all the hype for appetite-suppressing injections that help people lose weight, sometimes to an extreme extent they never planned on, we've come across something that might hold on to muscle mass. Skeletal muscle mass has long been undervalued by mainstream medicine in discussions about obesity and type 2 diabetes, but the truth is that muscle plays a monumental role in global metabolism. Muscles utilize the majority of glucose, regulate insulin sensitivity, and provide the strength and mobility we need for everyday activities. Losing muscle can be dangerous, leading not only to weakness, but also to further metabolic instability. This new therapy, then, cultivates something we might call a metabolic sweet spot. By pumping up muscular activity, you keep blood sugar levels in check and also open the door to healthier weight management. The preclinical data suggests a marked shift toward fat burning, a phenomenon that's been tricky to capture without undermining muscle tissue. For patients battling the double whammy of obesity and type 2 diabetes, the possibility of dropping weight while safeguarding muscle is an absolute game changer. Let's address the big question: what happens next? At this juncture, the team behind the drug, together with the company developing it, are poised to launch a larger phase 2 clinical trial. The step from phase 1 to phase 2 is a significant leap, often requiring more volunteers, more extended treatment durations, and more detailed monitoring of everything from blood chemistry to body metrics like fat mass and muscle strength. Phase 2 should reveal whether the same promising results that showed up in early tests hold steady under bigger and more diverse populations. We can't ignore the practical ramifications of such a drug, should it prove successful. Millions of individuals wrestle with type 2 diabetes every day, and a substantial portion find themselves stuck with the side effects of existing treatments or are not meeting their health goals with those treatments. Meanwhile, obesity is a global crisis. It's not just about how much you weigh, it's about the increased risk of heart disease, stroke, certain forms of cancer, and a life overshadowed by poor mobility and reduced opportunities. If there's a new weapon in the fight against these issues that doesn't demand needles and invasive administration, you can bet the world will take notice. Of course, we should temper our excitement with a dash of scientific caution. Newly developed therapies, especially in the metabolic domain, have in the past delivered incredible promise in small, early trials, only to stumble once hundreds or even thousands of individuals start taking them. Safety concerns sometimes emerge over the long term, or the effect might not remain as strong when used in a more general population. Another factor to consider is cost. Will such a medication be financially feasible and widely accessible, or will it remain, at least initially, an option for only a segment of patients with good insurance coverage or the means to afford it out of pocket? In any case, these issues don't dampen the importance of the original discovery. The very notion that we can harness and re-engineer a beta-2 agonist, an approach historically tied to concerns about cardiac overstimulation, speaks volumes about how far we've come in our understanding of these pathways. It underscores the promise of medical science in the 21st century to refine, to reconfigure, and to isolate beneficial metabolic actions while reducing harmful side effects. Let's circle back to the role of muscle in metabolic disease, an aspect often overshadowed by the focus on appetite or insulin sensitivity alone. When you think about your own body composition, you might care about muscle primarily for aesthetic or strength reasons. However, in type 2 diabetes, muscle tissue is an unsung hero. It's a critical site of insulin-stimulated glucose uptake, meaning that more robust or metabolically active muscles can stabilize your blood sugar by simply existing and working quietly in the background. Furthermore, muscle mass is correlated with healthier aging, improved mobility, and even longer life expectancy. Taking that away, as many standard treatments inadvertently do, can undermine overall health outcomes. That is why the new compound's capacity to stimulate fuel usage in muscle without the drawbacks of older beta-2 agonists, like an accelerated heart rate, shaking, or chest discomfort, is so groundbreaking. Preliminary data from human volunteers reveals that it's well tolerated and delivers a kinder, gentler approach for the body. The notion that we can specifically target muscle cells' metabolic machinery, coaxing them into faster, more efficient glucose burning, stands as a triumph of modern pharmacology. All of this leads us to the final piece of the puzzle, a reliable and exciting synergy. The lead scientists have suggested that this agent could combine with GLP-1 therapies, creating a complementary blend that addresses both appetite regulation and skeletal muscle metabolism. Think about it. If you're someone who needs help controlling appetite but doesn't want to risk losing muscle, you could potentially keep using your tried and tested GLP-1 medication while embracing this new pill to support your metabolism at the muscular level. It's almost like building an advanced toolkit that clinicians can customize to each patient's unique needs. And since we're nearing the heart of our discussion, I want to take another short moment to invite you, only if you're enjoying this conversation or learning something valuable, to subscribe and share this video with anyone who might benefit from up-to-date insights on emerging medical breakthroughs. It truly helps us continue providing you with the most riveting stories unfolding in health and science. Returning to the story at hand, the drug's supporters anticipate that a Phase 2 clinical trial will confirm its safety and benefits at larger scales. Should that trial proceed swimmingly, it's common for a subsequent Phase 3 trial to zero in on efficacy across thousands of participants, ensuring the results hold firm in broad, real-world scenarios. That's often where we finally get clarity on whether the medication can stand up to additional scrutiny, especially in subgroups who have other health conditions, take multiple daily prescriptions, or vary drastically in age and background. If the day comes that this therapy hits the market, it has the potential to instill new optimism in the realm of metabolic health. For instance, consider a middle-aged individual with type 2 diabetes who has struggled for years to keep blood sugar stable and weight in check. They might have faced the unpleasant side effects that led them to discontinue or limit prior options. Suddenly, a pill that not only helps manage their condition, but spares them the drudgery of constant stomach disruptions and preserves precious muscle, might be the lifeline they've been awaiting. Doctors often highlight the value of consistent exercise and a balanced diet, but for many patients, medication remains a vital pillar of disease management. Finding one that best fits into a sustainable lifestyle can be just as critical as discovering one with the strongest effect in a vacuum. The interesting detail to note is that among the article's authors are several who work with or hold shares in the company that's backing this promising new drug. Now, some might look at that and cry, conflict of interest. Indeed, it's important that everything is done above board and that results are validated by independent bodies. But industry collaboration also ensures that developments can leave the lab bench and make their way into pharmacies. In a perfect world, you want a healthy mixture of corporate and academic synergy. Labs generate breakthroughs, and companies refine them, navigate regulatory pathways, and handle large-scale production. Stepping back, we can see how unusual it is for a brand new study from an array of institutions worldwide to sow seeds of hope that might one day flower into a widely used therapy. But that's the nature of modern biomedical research. Laboratories in Sweden, Denmark, and Australia band together, pooling resources, knowledge, and technology to bring the dream of better metabolic management one step closer to reality. And let's not forget how technology itself, from advanced molecular design software to sophisticated imaging and measurement techniques, enables us to map out precisely which parts of muscle cells we want to target and how we can do so without provoking negative cardiac repercussions. As we wind down our discussion, it's worth reiterating the unique selling point of this new therapeutic approach. It addresses everyday metabolic processes right at the muscular foundation, without the characteristic issues of appetite suppression or gastrointestinal stress. It signifies a new wave, or possibly even a new era, in metabolic medicine, should upcoming clinical results remain equally positive. It is also a testament to the value of exploring alternative angles in medical science. Instead of focusing solely on gut-brain signals, we put muscle front and center, reaping the potential rewards that come from activating nature's largest engine of glucose utilization. So, in summary, keep your eyes on the horizon. If you or a loved one has struggled with the daily routines, the emotional toll, and the persistent unknowns regarding type 2 diabetes or obesity, hope might indeed be on the way in the form of an oral medication that breaks the mold. Just imagine a future where you're not forced to give yourself injections weekly or monthly, a future where the medication you rely on for glycemic control doesn't hamper your normal appetite or lead to muscle deterioration, but instead empowers you with better overall metabolic balance. That's the story being laid out by these intrepid scientists who announced their findings in the journal Cell. Their next step is a more extensive human trial, the results of which could well shape the future of diabetic and weight management therapies. We will be keeping a close eye on how this story evolves, and as soon as new findings emerge from the Phase 2 trials, we'll bring you the inside scoop right here. For now, it sure seems like we have exciting times ahead, full of fresh approaches to an age-old challenge. Thank you for joining us on this deep exploration. If you're feeling that burst of optimism or curiosity about what modern science can accomplish, remember that every new story like this is built on decades of incremental research and unwavering dedication. We can only hope that, with continued effort, the best solutions, those that truly transform and uplift our collective health, rush forward.